Good morning, Abdi. How are you? Good morning, students. How are you? Well, today we have a very interesting technique, which is the change of position with 3 pillows. We are going to use this technique in patients who have been in bed for a long time. Abdiel is a 19-year-old boy who had an accident and is currently in the hospital in rehabilitation. So he has been in bed for a long time, and for this the doctor has told us that we must change his position every 2 hours. At this time we are going to do the technique of the 3 pillows. So for this technique, the first thing we are going to do is introduce ourselves to the patient, right? Tell him what we are going to do, and if he agrees. Abdil, I am Magalis Herrera, your nurse assistant today. I come to make the change of position. Do you agree? If Abdiel agrees, then we go to wash our hands and close the curtain for the privacy of the patient, right? We are going to wash our hands. Once the hands are washed, the first thing we are going to do when we arrive is verify the identity of the patient. We are going to see the identification, whether it is Abdiel Rivero Herrera, to continue with the technique. Then we are going to look for all the utensils that we are going to have for the technique. For this, we are going to use 3 pillows, a patient covering towel, and we are going to put on top of the table or support a disposable towel or cloth towel. Once we have everything prepared for the technique, then the first thing we are going to see is what position the patient's bed should be in and what position he is going to be in. So we are going to raise it to put it at the height of our private cavity, right? So that it is more comfortable for us. We are also going to lower the railing, right? To be able to work with him. So, the first thing we are going to do for the technique is to think that also in many hospitals, they are going to require the use of gloves. Because we are also going to see that these patients are patients who are going to be contaminated. In the case of Abdiel, he is a patient who does not have any sex. And everything we're going to use is clean, so there is no need to use gloves because we have clean hands. But we have to take that precaution that many hospitals are going to require, or in the place where we are working, we are going to know that we use gloves. So now we would move on to the use of gloves in case we did. Now we are going to cover the patient, right? Because it is very important to maintain the privacy of the patient. We are going to put the towel on top of the patient, right? We say, Abdiel, could you help me by holding the towel here, please? Once he holds the towel, we are going to run the sheet in the shape of a roll, right? Towards the patient's feet to be able to do this technique correctly and much easier. Once it is in this position, then we have to bring the patient to the edge of the bed. When it is a patient who does not operate, we must do it. That is why we had talked about the position of the bed. It has to be very comfortable because you have to make the effort to move the patient. But when it is a conscious patient like Abdiel, he is going to help us. And on the count of 3, we are going to come a little towards my Abdiel, right? We are going to put one hand under the neck, the other under the knees. And we are going to count from 3 to 10. You throw me here, right? 1, 2, 3. A little more, Abdiel. E-R. 7. Once on the patient's bedside, we are going to turn him to the opposite side. We are going to turn him to the opposite side. We are going to have the detail that we can take the towel out of there. We are going to first adjust the pillow of the head. Let's see, Abdiel. We help here with the head. We accommodate it with this pillow. And then we move on to the back pillow. This pillow, we are going to put this edge with pressure under the patient. Like this. Under the back, everywhere. Once it has entered, we take the other edge, we bend it, and in the shape of a knee, we also put it under the back of the patient. And then we tilt it a little bit there. Let it lie comfortably on top of that pillow. Now the next pillow is the one of the ankles, the one of the leg. We are going to be careful to put it at an angle of 90 degrees, like this. We come, we raise, and we put it here. Here. Look, I'm going to move away so you can see. This position is the correct one. It has to be on top of the pillow, the knee and the ankle. Why? Because they are the joints that are going to have the most pressure on the body. And let's remember that these are patients who have been in bed for a long time, and that pressure on top of the joints can cause ulcers due to pressure. So this pillow has to be in this position, remembering the knee and the ankle. We cover it again. And then now we go to the other pillow. The third pillow is under this hand. We are going to put it like this, comfortably, in such a way that we are also covering the elbow. We have to be careful that that hand, the hand that is under the body, does not stay under the body, but we take it out a little bit because of the circulation issue. Abdiel, do you feel comfortable like this? Is it okay like this? Good. So if Abdiel feels good, then we are going to cover him with the pillow.